one thing I have learned on my trips around the world is that we don't have all the answers here, and that there are a lot of smart people out there around the world that have some really great ideas. Their systems may be different, the way they pay, the way they provide, but there are real nuggets of information and ideas that we can incorporate back into our system to improve our system to provide more access, better quality care, and better results at hopefully a lower cost, which then hopefully will then add more opportunity. So that's really from my perspective where this came about. And then partnering with you and with Eric, providing more subject matter expertise to that. I think we've been able to develop an ecosystem here that didn't exist, I don't think, around health innovation anyway, that I believe now can be world leading.
So the Global Health Innovators Summit 3 scheduled for September 16th, 2026 here in Nashville, Tennessee. Want to make sure we get people from all around the world to attend that event to connect with Nashville and US healthcare ecosystem, to talk about healthcare innovation and to really see what the possibilities are for working together. I want to talk about innovation. That's what is on everyone's mind right now. How does Nashville show up differently than other markets in the healthcare innovation space?
I'll start with that one. I think Nashville's history and roots and really its expertise is in scaling business model. And that really started with HCA and hospital affiliates and some of those companies that were formed 6 decades ago when nobody really understood that you could actually put together a company that would operate geographically acute care hospitals and benefit from standardization and centralization of activities. In over 6 decades, you have just a tremendous amount of resources of individuals that really understand the business of healthcare, the complexities around payment, the complexities around clinical care delivery, the intersection with policy, and the intersection with CMMI, the Center of Medicare and Medicaid Innovation, and some of those programs that are really driving alternative payment models. That those intersections allow us to have the footprint necessary to really represent a lot of the US. And what I think we can really benefit from the global health innovators is to understand how innovation is applied either at the company level, at the region level, or at the association level, or at the academic center level, and how research occurs that drives innovation and how business accepts that. Those are some differences, but I also think some learnings for us as a community.
John, when you are on an airplane, you sit on a lot of airplanes and you're sitting
Mhm.
next to somebody and you're giving kind of the business case for Nashville. What's that story?
So a lot of times what I tell people is one thing, first of all, I get their sense of, do you think it's just country music? And then we start going into that it's so much more than that in terms of the talent that is here. What, 23 colleges and universities in the area and the education. Do you have a young, talented, educated pool? You have an older educated pool that you can draw from. You have through the entertainment though industry, what I've learned is that songwriters are very creative, very innovative. And so now that translates into so many different functions within a company, especially around innovation, and of course, it sits, what, within 10 hours of 70% of the US market.